Welcome student on another video lecture. Today's topic is Niosomes. Niosomes are microscopic lamellar structure formed by admixture of non-ionic surfactant, cholesterol and charge-induced agent with subsequent hydration in aqueous media. So what are these? These are microscopic lamellar structure, and how they are formed? They are formed by admixture of non-ionic surfactant, cholesterol and charge-induced agent which is followed by hydration in aqueous media. They are made up of both hydrophobic and hydrophilic moieties and thus can accommodate drug molecule with a wide range of solubility. So both hydrophobic and hydrophilic moieties or drug molecules can be incorporated or can be embedded in case of Niosome. Niosomes have been evaluated in many pharmaceutical and therapeutic applications due to their ability to reduce systemic toxicity by encapsulation of treatment agent and minimize clearance of such agent from the body by slow drug release. So here is the structure of Niosome. Hydrophobic natural drug. This one is the hydrophobic natural drug. This one is the cholesterol. And these two layers are of non-ionic surfactant. These are the layers of non-ionic surfactant, and hydrophilic natural drug is embedded here. In the central core, central aqueous core, the hydrophilic natural drug is embedded, whereas hydrophobic drug is embedded between two layers of non-ionic surfactant. Now advantages: they are biodegradable, biocompatible, non-toxic, non-immunogenic. They can encapsulate large amount of material in small volume of vesicle. They provide better patient adherence and satisfaction and better effectiveness than conventional oily formulations. They can entrap wide range of hydrophilic, lipophilic and amphiphilic drugs due to their unique structure. Their shape, fluidity and size can be easily controlled by changing their structural composition and production method. They can be administered via oral, parenteral, topical route in different dosage form such as semi-solid, powder and suspension. Their storage is easy to the chemical stability of structural composition. Now, method of preparation. Niosomes are prepared by hydration of surfactant and lipid mixture at elevated temperature, followed by Niosome size reduction to obtain colloidal suspension. So basically it is prepared by hydration of surfactant and lipid mixture, which is carried out at elevated temperature and which is followed by size reduction. Some well-studied standard method for preparation of Niosomes include ether injection, hand shaking, sonication, microfluidization method. Subsequently, the non-entrapped drug is separated from the entrapped drug by centrifugation, gel filtration or dialysis. Now, ether injection method. The surfactant is dissolved in diethyl ether. The resultant solution is injected through a 14 gauge needle into a aqueous solution of drug maintained at 60 degrees Celsius. So in case of ether injection method, first surfactant that is dissolved in diethyl ether, then that solution which is produced, it is injected into the aqueous solution of drug and the temperature maintained is 60 degrees Celsius. This results in evaporation of ether and subsequent formation of single layered vesicle with 50 to 1000 nanometer diameter. However, a small amount of residual ether often remain in niosomal suspension. So, which is followed by evaporation of ether and formation of single layered vesicle. Next method is hand shaking or thin film hydration method. Surfactant and cholesterol are dissolved in volatile organic solvent and transferred to a rotary evaporator. After evaporation, a thin layer of solid mixture gets deposited on the wall of the flask. This dried layer is hydrated with aqueous phase containing the drug to be entrapped, and this process is carried out at room temperature with gentle agitation. So here surfactant and cholesterol, they are dissolved in organic solvent, then they are transferred to a rotary evaporator. It will produce on evaporation a thin film and which is deposited on the wall of the flask. The dried layer is hydrated with aqueous phase containing drug which is to be entrapped, and this process is carried out at room temperature with gentle agitation. Another method is sonication method. A mixture of surfactant, cholesterol and aqueous phase containing drug are sonicated at 60 degrees Celsius for 3 minutes. As a result, small and uniformly sized vesicles are produced. So here complete mixture is taken of surfactant, cholesterol and aqueous phase containing drug, and complete mixture is sonicated at 60 degrees Celsius for 3 minutes, and which results into formation of uniformly sized vesicles. Another method is microfluidization method. In this method, two fluidized streams move forward through a precisely defined microchannel and interact with each other at an ultra high velocity, and it will form uniformly sized niosomes. Another method is reverse phase evaporation technique. In this method, cholesterol surfactants, they are used in a ratio of 1:1 and dissolved in a mixture of ether and chloroform. On adding aqueous drug solution to this, water in oil emulsion is produced. So here first cholesterol and surfactant, they are taken in a ratio of 1:1, that is dissolved in ether and chloroform mixture, and then the aqueous drug is added. It will produce an emulsion. Now the two phases are sonicated at 4 to 5 degrees Celsius, and the emulsion is dried in an rotary evaporator at 40 degrees Celsius to form semi-solid gel of large vesicle. Now these phases are sonicated and the emulsion is dried in rotary evaporator. It will produce gel with large vesicle. Now in that gel, phosphate buffer saline is added in small amount to clear the gel. Again it is sonicated. The organic phase is removed at 40 degrees Celsius under reduced pressure, and viscous neosomal suspension is diluted with phosphate buffer saline, and it is heated on water bath at 60 degrees Celsius for 10 minutes to form niosomes. So after sonication, then evaporation, after evaporation addition of phosphate buffer. After addition of phosphate buffer, organic phase is removed. After removing of organic phase, now that suspension is diluted with phosphate buffer saline, and it is heated on water bath at 60 degrees Celsius for 10 minutes to form niosome. After that, multiple membrane extrusion method. A mixture of surfactant, cholesterol and diacetyl phosphate in chloroform forms a thin film by rotary evaporator. That film is hydrated with aqueous drug polycarbonate membrane. The solution and resultant suspension are extruded through polycarbonate membrane and placed in series up to 8 passages. So here first surfactant, cholesterol and diacetyl phosphate, they are taken in chloroform, evaporated, thin film is formed. That film is hydrated with aqueous drug polycarbonate membrane, and the resultant solution is extruded through polycarbonate membrane. Now transmembrane pH gradient drug uptake process. In remote loading process, surfactant and cholesterol, they are dissolved in organic solvent. So in first step, surfactant and cholesterol, they are taken and they are dissolved in organic solvent like chloroform. After that, solvent evaporate under reduced pressure, leaving behind a film on the wall of round bottom flask. Film is hydrated with 300 millimole citric acid and pH is maintained, that is 4, by vortex mixing. Now after evaporation of solvent, a thin film is produced which is deposited and it is hydrated with 300 millimolar citric acid. Multi-unilamellar vesicles are frozen, thawed 3 times and which is followed by sonication. For niosomal suspension, aqueous solution containing 10 mg per ml drug is added and vortex. Now the drug is added and the concentration of drug is 10 mg per ml. And sample pH is raised to 7 to 7.2 with 1 molar disodium phosphate. Now that mixture is heated to 60 degrees Celsius for 10 minutes to yield niosomes. So first surfactant and cholesterol, they are dissolved in chloroform, solvent evaporated, thin film is formed, that film is hydrated with citric acid. Then niosomal aqueous solution containing drug which is added, it is again vortex, sample pH raised to 7.2 and the mixture is heated at 60 degrees Celsius for 10 minutes to yield niosomes. Emulsion method. In this simple method, oil in water emulsion is prepared from an organic solution of surfactant, cholesterol and aqueous solution of drug. Then organic solvent is evaporated and niosomes are dispersed in aqueous phase. So simple method, oil in water emulsion. How it is prepared? Organic solution of surfactant and cholesterol and aqueous solution of drug which will produce oil in water emulsion. That then organic solvent is evaporated and the niosomes will disperse in aqueous phase. Heating method. In this one step, culpable non-toxic method, suitable aqueous medium is added with mixture of non-ionic surfactant, cholesterol and charge induced molecule in presence of glycerol. The resultant mixture is heated until the vesicles are formed. Formation of niosomes from proniosomes. Proniosomes are dry formulations in which each water soluble particle is covered with a thin film of dry surfactant. So each water soluble particle or water soluble particle of drug which is surrounded by a thin film of dry surfactant, that is proniosomes. These are the dry formulation. And niosomes are recognized by adding aqueous phase with brief agitation when T is greater than Tm, where T is the temperature and M is the mean phase transition temperature. Now lipid injection method. In this method, mixture of lipid and surfactant is melted and then injected into a highly agitated heated aqueous phase containing the dissolved drug. The drug dissolved in molten lipid and mixture is injected agitated heat aqueous phase containing surfactant. So mixture of lipid, surfactant, it is melted and it is injected highly agitated aqueous phase which contains the dissolved drug. Now that dissolved drug is molten in lipid, and mixture is injected agitated in heat aqueous phase containing surfactant. Now here some example of niosomes. Colchin niosomes. Application is prolonged release profile, biological activity, rheumatic complaints, Silymarin increases drug bioavailability, liver and gallbladder disorder. It is used against liver and gallbladder disorder. So this is about the detailed account on niosomes. Thank you.